Well, hello there. I'm here today with Dr. Andrew Brostek to ask him a few questions about tooth lightening. Andrew is a full-time private practitioner with 30 plus years of experience, and he has published a number of papers in numerous journals and magazines. Andrew is also a clinical senior lecturer in operative dentistry at the University of Western Australia. Hi Andrew, it's a real privilege to be having this chat with you today, and I want to thank you for sharing your time and your knowledge about tooth lightening with us.
Pleasure.
I suppose the first question I'd like to ask you is, what is tooth lightening and how does it differ from tooth whitening?
Yes, it's a very interesting topic actually, because Professor Laurie Walsh around 2008 did a lot of research into the effect of tooth lightening by using CPP-ACP, particularly Tooth Mousse Plus, to actually increase the blue light scatter off the enamel. And this gives the appearance of whiter teeth, but it's an illusion compared to true tooth whitening. True tooth whitening is to use an oxidizing agent like hydrogen peroxide, which actually irreversibly changes and reverses the stain molecules on the enamel and even penetrating and reversing the dentine stains. So that's true whitening compared to lightening. An understanding of tooth optics helps us as well.
Right, that's a great answer, and I'm sure that will help to clear up the differences in the procedures for many clinicians out there. You mentioned a basic understanding of tooth optics is important.
Yes.
Can you explain tooth optics to me?
Yes, another interesting topic for me is that our eyes are more susceptible to the yellow-green light than they are to blue light. So in fact, if we can improve the blue light scatter of the enamel, that gives us a lightening effect. The other thing is, as teeth age, they appear more yellow by accumulating external stain, and also by microcracks in the enamel allowing stain molecules through into the dentine. And lastly, the enamel itself becomes thinner as we age. So you're seeing more yellow, and if we can increase the blue light scatter, you actually decrease the amount of yellow light that we see.
Right. So I know Tooth Mousse Plus is a key component of tooth lightening, but I'm interested to understand in more detail the role it actually plays in achieving the improved luster of the treated enamel.
Yes, the CPP-ACP increases the mineralisation of the enamel, as I've mentioned, but it also increases the crystallinity of that enamel that you're building. So I think a simple explanation is, on a microscopic level, you're rebuilding the enamel to a better enamel that actually reflects the blue light in a better way, therefore improving the lustre and also possibly improving the translucency.
Right, so is the promotion of enamel mineralisation gained from the application of the Tooth Mousse Plus, which actually improves that lustre and translucency of the tooth enamel, and therefore giving us the overall effect of lighter enamel?
Yes, exactly.
Right. How long does it actually take to achieve tooth lightening, Andrew?
Oh, that's a really good question, because it varies from patient to patient. It even varies from tooth to tooth, as you can imagine.
Yeah.
And if we look at case number one of a lady that presented with white spot lesions on her teeth, and I had her home apply a pea-sized amount of Tooth Mousse Plus to her teeth for about 10 weeks, we achieved the reversal of the white spot lesions. But interestingly, if you look at the pictures, the after picture shows, in fact, a great lightening effect of the enamel as well.
Yeah, absolutely. So Andrew, as a hygienist, I always recommend a Tooth Mousse Plus for my whitening patients for 2 weeks prior to their whitening treatment, and then ongoing after they'd had their whitening treatment, to help with sensitivity concerns. But I've always been really interested to know if tooth mousse would actually enhance the overall results of, say, in-chair or at-home whitening.
Yes, another good question, in that protocol is what I follow as well 2 weeks before. But refer to the second case pictures we're showing of a patient that had true tooth whitening with the hydrogen peroxide, followed by home application of peroxide as well. Mm-hmm. And in fact, the end result wasn't good enough for the patient or ourselves. We thought we could do better. Okay. So what we did is get the patient to apply Tooth Mousse Plus every night after toothbrushing, in fact for several months, and he and all of us were quite surprised, in fact, that the teeth looked considerably whiter at the end.
Yeah, brilliant. So I see the concept of tooth lightening is really quite different from that of tooth whitening, in that the tooth lightening does not involve the use of any oxidizing agents such as hydrogen peroxide.
Yes.
And in fact we're actually achieving an overall illusion of whiter teeth.
Yes, and we're optimising the whitening by doing the lightening effect as well in that particular case.
Right, so I have another question for you, Andrew, and it's about the little annoying white patches that sometimes become more noticeable after we've done tooth whitening. And these are often a real problem for the patient and the clinician when the patient comes back to us pointing out these little white patches to us. So it's generally not very aesthetic for the patient.
Yes.
Is there a protocol we could follow for reversal of these areas?
Yes. Again, an excellent question, because it's often very disappointing when we do a whitening case and there are a lot of hypocalcific areas that brighten and whiten even much more than the background of the tooth. So it's a real problem for the patient who's disappointed and for us. And based on the work of the late Nathan Cochrane from Eric Reynolds Melbourne's University Research Group, Nathan developed a technique of, in fact, applying sodium hypochlorite, rubbing on the surface of the tooth to remove the lipid protein on the surface. Right. And then, in fact, a second improvement was diluting the tooth mousse plus before you put it on the teeth themselves. So the actual protocol, the steps of the protocol are, of course, pumicing the tooth first to clean the tooth. Secondly, isolating the tooth with liquid dam to make sure the sodium hypochlorite doesn't leak out. Yep. And then Nathan's technique of rubbing the surface for 2 minutes with the sodium hypochlorite, rinsing it off and drying. And then we have some pictures of dilution of the tooth mousse where you get a dappen and you put a small amount of tooth mousse in the bottom and add a lot of water, or even glycerine, which enhances the effect as well, and then painting it immediately onto that clean surface, which is absorbed straight into the enamel and in fact improves the mineralisation. And in fact, Eric Reynolds' group has shown that if we can achieve 60% increase in the calcium concentration into the white spot lesion, in fact, that will change the refractive index and give you a better appearance, a normal appearance. And of course, we can't forget that the patient must home apply the Tooth Mousse Plus every night after brushing their teeth.
Of course. So the next question that I would have for you is, in regards to these patients, do you ever have any difficulty in reversing these little white spot lesions?
No one likes to talk about failure, least of all me, but I must say that the next case of quite a severe white spot lesion where a lady came in and said, look, can you reverse it? And I said, of course, we'll try the remineralisation with the CPP, ACP, and I've tried all the techniques that we've just discussed in terms of pumice, microabrasion with the pumice, and in fact cleaning with sodium hypochlorite, and then even trying the old acid etch technique of cleaning the surface. If that